I am Dr. Naeem. Welcome to my channel, and today's topic is scabies. Let's start. What is scabies? Scabies is a contagious skin condition caused by the mite Sarcoptic scabies, which burrows into the skin, causing intense itching and rashes. It affects both children and adults, spreading through close skin-to-skin contact in settings like schools, households, or care facilities. Globally, millions are affected annually, with higher prevalence in crowded environments. Prompt treatment stops the spread and prevents complications like secondary infections. Types of scabies. Classic scabies, most common in children and adults, with mites causing rashes and itching in skin folds. Nodular scabies, raised, red nodules in sensitive areas, seen in prolonged cases, more frequent in adults. Crusted, Norwegian, scabies, rare, severe form with thousands of mites, occurs in immunocompromised individuals, including adults with HIV or children with malnutrition. Infantile scabies, affects infants, often involving scalp, face, or soles, less common in adults. Anatomy and physiology of the skin. Scabies disrupts the skin structure and function. Anatomy. The epidermis, outer layer, contains the stratum corneum, a barrier of dead cells and lipids. The dermis houses blood vessels, sweat glands, and nerves. Children's skin is thinner, allowing easier mite penetration, while adult skin is tougher but still susceptible in close contact. Physiology. The stratum corneum blocks pathogens, but female mites burrow into it to lay 10 to 25 eggs, creating tunnels. Mite saliva, eggs, and faces trigger an immune response, releasing histamine and cytokines, for example, IL-4, causing itching and redness. Scratching damages the skin, risking bacterial infections, Staphylococcus aureus or Streptococcus pyogenes. Children's sensitive immune systems amplify itching, while adults may develop chronic symptoms. In prolonged cases. Causes. Scabies in children and adults is caused by mite infestation. Primary cause, Sarcoptes scabiei mites, transmitted via direct skin contact, hugging, sharing bedding, or, rarely, infested objects. Risk factors, crowded living conditions, for example, schools for children, care homes for adults. Poor hygiene or limited access to washing facilities. Immunosuppression, for example, HIV in adults, malnutrition in children. Child-specific causes, close contact during play or day care. Existing skin conditions. Eczema, easing mite entry. Adult-specific causes, occupational exposure. Healthcare workers. Sexual contact as a common transmission route. Triggers, mites survive 24 to 72 hours off the body, spreading via shared clothes, towels, or bedding. Signs and symptoms appear 2 to 6 weeks after initial infestation, or 1 to 4 days in infestations. Children, intense itching, worse at night, causing irritability or sleep issues. Red, pimple-like rashes, burrows, wavy lines, or pustules between fingers, wrists, elbows, or buttocks in infants. Rashes on scalp, face, palms, or soles. Nodules in severe cases. Adults. Similar itching and rashes, often in armpits, waist, inner thighs, or genitals. Nodular or thickened skin in chronic infestations. Less likely to affect the face or scalp. Complications, secondary bacterial infections, impetigo, from scratching, more common in children. Post-streptococcal glomerulonephritis, rare, from streptococcus infections. Note, children's symptoms may mimic eczema, while adults may resemble dermatitis, requiring careful diagnosis. Scabies in children and adults is primarily clinical. Clinical assessment, history, nocturnal itching, close contacts with symptoms, or exposure. Setting: school, workplace. Physical exam, identify burrows, rashes, or nodules in typical sites, hands in children, genitals in adults. Tests, skin scraping, microscopic exam to detect mites, eggs, or faces, more common in atypical cases. Dermoscopy visualizes burrows. Non-invasively adhesive tape test, collect skin debris for microscopy. Challenges, misdiagnosis as eczema, psoriasis, or insect bites is common, especially in children with atypical rashes or adults with nodular forms. Action, persistent itching or rashes, especially in multiple household members, needs medical evaluation. Treatments: eradicate mites and relieve symptoms. Medical treatments: topical scabicides, permethrin 5% cream, applied from neck down, or scalp in infants, left on for 8 to 14 hours, washed off, safe for children greater than 2 months and adults, repeat after 7 days. Benzyl benzoate 25%, alternative, diluted for children, used for 24 hours. Sulfur ointment, safe for infants less than 2 months or adults with sensitive skin, applied for 3 to 5 days. Oral scabicides, ivermectin single dose, 200 micrograms/kg, for crusted scabies or treatment failure. Used in children greater than 15 kilograms and adults. Repeat after 7 to 14 days. Antihistamines, cetirizine, children, or hydroxyzine, adults, to reduce itching. Antibiotics, oral, amoxicillin, or topical, mupirocin, for secondary infections, common in children. Care: treat all close contacts, family, partners, classmates, simultaneously to prevent reinfestation. Bedding, clothes, and towels in hot water, greater than 60 degrees Celsius, and dry on high heat. Seal non-washable items in plastic bags for 72 hours. Counseling to address embarrassment or stigma, especially in children or adults. Note: full adherence to treatment prevents recurrence. Itching may persist 2 to 4 weeks post-treatment. Home remedies support medical treatment and ease discomfort. Cool compress, apply a cool, damp cloth to itchy areas for 10 minutes, 2 to 3 times daily, to soothe skin in children and adults. Oatmeal baths, soak in 1 cup colloidal oatmeal for 10 minutes daily to reduce itching. Suitable for all ages. Coconut oil, apply a thin layer after scabicide treatment to moisturize. Avoid during active infestation. Aloe vera, use pure gel on irritated areas to calm inflammation. Test for sensitivity. Loose clothing, wear soft, breathable cotton to minimize irritation, especially for children. Hygiene, daily bathing with mild soap to prevent secondary infections, critical for both groups. Tea tree oil, dilute with carrier oil, 110, apply sparingly post-treatment for mild antiseptic effects, avoid in infants. Caution: home remedies don't kill mites, use alongside prescribed treatments and consult a doctor if symptoms persist. Most affected gender: scabies affects both genders equally in children and adults. No gender bias, transmission depends on contact, not sex. Social impact: children may face school disruptions, adults may experience workplace or social embarrassment. Management focus: scabies in children and adults can be uncomfortable, but with early diagnosis, treatments like permethrin and ivermectin. If you found this helpful, like, subscribe, and share for more insights on MedWise by Dr. Naeem. Comment below: how do you manage itchy skin? Stay healthy, and I'll see